121. A 5-year-old should be able to dress themselves independently. True or false? Answer: true. Rationale: by age 5, children typically can dress themselves, reflecting fine motor and self-care development per school-age developmental milestones. 122. Whole milk is recommended for children over 5 years. True or false? Answer: false. Rationale: children over 2 can transition to low-fat or skim milk to reduce saturated fat intake per pediatric nutrition guidelines. 123. The varicella vaccine requires only 1 dose for full protection. True or false? Answer: false. Rationale: the varicella vaccine requires 2 doses at 12 to 15 months and 4 to 6 years for full protection against chickenpox per CDC immunization schedules. 124. A temperature of 39 degrees Celsius is considered normal for a 6-year-old. True or false? Answer: false. Rationale: a 6-year-old's normal temperature is 36.6 to 38 degrees Celsius. 39 degrees Celsius indicates fever, requiring assessment per pediatric vital sign norms. 125. Play is an effective way to assess a toddler's developmental status. True or false? Answer: true. Rationale: observing play helps assess a toddler's motor, social, and cognitive development per pediatric assessment principles. 126. Smoke detectors are optional in homes with adolescents. True or false? Answer: false. Rationale: smoke detectors are essential in all homes, including those with adolescents, to prevent fire-related injuries per pediatric safety guidelines. 127. The Babinski reflex is normal in a 2-year-old. True or false? Answer: false. Rationale: the Babinski reflex typically disappears by 12 to 24 months. Its presence in a 2-year-old may indicate neurological issues per developmental milestones. 128. Adolescents should receive the same medication doses as younger children. True or false? Answer: false. Rationale: adolescent medication doses are often weight-based or closer to adult doses due to mature metabolism per pediatric pharmacology principles. 129. Distraction techniques are effective for pain management in adolescents. True or false? Answer: true. Rationale: distraction, such as music or games, reduces pain perception in adolescents by engaging their attention per pediatric pain management guidelines. 130. Nurses can administer vaccinations without documenting the lot number. True or false? Answer: false. Rationale: documenting the vaccine lot number ensures traceability and safety, a requirement for all vaccinations per pediatric medication standards. 131. A 2-year-old should be able to follow simple 2-step instructions. True or false? Answer: true. Rationale: by age 2, toddlers can follow simple 2-step instructions, reflecting cognitive and language development per toddler developmental milestones. 132. Infants should receive water as a supplement to breast milk at 3 months. True or false? Answer: false. Rationale: exclusively breastfed infants do not require water supplements before 6 months, as breast milk meets hydration needs per pediatric nutrition guidelines. 133. The DTaP vaccine is administered at 11 to 12 years as a booster. True or false? Answer: true. Rationale: the DTaP vaccine, a DTaP booster, is given at 11 to 12 years to maintain protection against diphtheria, tetanus, and pertussis per CDC schedules. 134. A pulse rate of 150 beats per minute is normal for a resting 8-year-old. True or false? Answer: false. Rationale: an 8-year-old's normal pulse rate is 70 to 110 beats per minute at rest. 150 indicates tachycardia per pediatric vital sign norms. 135. Family-centered care includes involving grandparents in care decisions. True or false? Answer: true. Rationale: involving extended family, like grandparents, supports family-centered care when appropriate, enhancing child and family well-being per pediatric nursing principles. 136. Bicycle training wheels are sufficient to prevent injuries in preschoolers. True or false? Answer: false. Rationale: training wheels reduce falls but do not replace helmets and supervision, which are critical for injury prevention, per pediatric safety guidelines. 137. The tonic neck reflex disappears by 6 months of age. True or false? Answer: true. Rationale: the tonic neck reflex, where head turning extends one arm, typically fades by 4 to 6 months per neonatal developmental milestones. 138. Adolescents require annual physical exams to monitor growth. True or false? Answer: true. Rationale: annual exams monitor growth, development, and health risks in adolescents, per American Academy of Pediatrics guidelines. 139. Oral rehydration solution is contraindicated in children with vomiting. True or false? Answer: false. Rationale: oral rehydration solution is safe and effective for children with vomiting, given in small, frequent sips, per pediatric treatment guidelines. 140. Nurses can disclose a child's diagnosis to non-custodial parents without consent. True or false? Answer: false. Rationale: disclosing a child's diagnosis to non-custodial parents requires custodial parent consent or legal authorization, per HIPAA and legal standards. 141. A 3-year-old should be able to stack 6 blocks. True or false? Answer: true. Rationale: by age 3, children can stack 6 or more blocks, reflecting fine motor development, per preschool developmental milestones. 142. Pureed foods are appropriate for 12-month-olds. True or false? Answer: true. Rationale: pureed or soft foods are appropriate for 12-month-olds transitioning to solids, supporting chewing development, per pediatric nutrition guidelines. 143. The hepatitis A vaccine is recommended for all children at 12 months. True or false? Answer: true. Rationale: the hepatitis A vaccine is given at 12 to 23 months to prevent liver infection, per CDC immunization schedules. 144. A respiratory rate of 50 breaths per minute is normal for a 4-year-old at rest. True or false? Answer: false. Rationale: a 4-year-old's normal respiratory rate is 20 to 30 breaths per minute at rest. 50 indicates tachypnea, per pediatric vital sign norms. 145. Storytelling is an effective psychosocial intervention for hospitalized preschoolers. True or false? Answer: true. Rationale: storytelling reduces anxiety and engages preschoolers, supporting emotional well-being, per pediatric psychosocial care principles. 146. Childproof locks are unnecessary for cabinets in homes with adolescents. True or false? Answer: false. Rationale: childproof locks on cabinets containing medications or chemicals remain necessary for adolescents to prevent misuse, per pediatric safety guidelines. 147. The Moro reflex is normal in a 9-month-old. True or false? Answer: false. Rationale: the Moro reflex typically disappears by 3 to 6 months. Its presence at 9 months may indicate neurological issues, per developmental milestones. 148. Adolescents can consent to all medical procedures without parental involvement. True or false? Answer: false. Rationale: adolescents can consent to specific procedures, e.g., reproductive health, in some states, but most require parental consent, per legal standards. 149. Acetaminophen can be used to manage fever in a 2-month-old. True or false? Answer: true. Rationale: acetaminophen is safe for fever in infants over 2 months when dosed correctly, 10 to 15 mg/kg, per pediatric pharmacology guidelines. 150. Nurses should report suspected neglect to Child Protective Services. True or false? Answer: true. Rationale: nurses are mandated reporters and must report suspected neglect to protect the child, per legal and ethical pediatric standards. 151. A 6-year-old should be able to read simple sentences. True or false? Answer: true. Rationale: by age 6, school-age children typically can read simple sentences, reflecting cognitive and language development, per developmental milestones. 152. Infants should receive cow's milk as a primary beverage at 9 months. True or false? Answer: false. Rationale: infants should not receive cow's milk until 12 months due to inadequate nutrients and potential gastrointestinal issues, per American Academy of Pediatrics Guidelines. 153. The Haemophilus influenza type B, HIB, vaccine reduces the risk of epiglottitis. True or false? Answer: true. Rationale: the HIB vaccine prevents infections caused by Haemophilus influenza type B, including epiglottitis, administered starting at 2 months, per CDC immunization schedules. 154. A normal respiratory rate for a 12-year-old is 30 to 40 breaths per minute. True or false? Answer: false. Rationale: a 12-year-old's normal respiratory rate is 16 to 20 breaths per minute at rest, similar to adults, per pediatric vital sign norms. 155. The nurse should use a car seat with a 5-point harness for a toddler. True or false? Answer: true. Rationale: a 5-point harness provides optimal safety for toddlers in car seats, securing the shoulders, hips, and pelvis, per American Academy of Pediatrics Safety Guidelines. 156. The APGAR score is used to assess long-term developmental outcomes. True or false? Answer: false. Rationale: the APGAR score assesses a neonate's immediate post-birth condition, not long-term development, which requires other tools, per neonatal assessment protocols. 157. Adolescents should be offered private consultations during health visits. True or false? Answer: true. Rationale: private consultations respect adolescent autonomy and encourage open discussion of sensitive issues, per American Academy of Pediatrics Guidelines. 158. Antipyretics are unnecessary for fevers below 38.5 degrees Celsius in children. True or false? Answer: true. Rationale: fevers below 38.5 degrees Celsius are typically monitored without antipyretics unless the child is uncomfortable, per Pediatric Fever Management Guidelines. 159. The FACES pain scale revised is appropriate for assessing pain in 4-year-olds. True or false? Answer: true. Rationale: the FACES pain scale revised is suitable for children as young as 4 who can interpret facial expressions, per Pediatric Pain Assessment Guidelines. 160. Medications can be administered to a child based solely on parental verbal orders. True or false? Answer: false. Rationale: medications require a written provider order or verification, not just parental verbal orders, to ensure safety, per Pediatric Medication Administration Standards.